A choking child, recognition of a child choking, and steps to take to first aid to help them should it happen. Now, when it comes to children, I'm talking about the age from 1 up to puberty, round about 12. Now, children are at higher risk of choking for the simple reason they move. Now, with a medical hat on, I would always advise that children are always sitting down while they're eating. Then I'm going to put on my parent hat on and say, good luck. It's very difficult sometimes when they run in and they grab a snack and run out again. So I do appreciate being a parent myself. It can be hard sometimes. The recognition of a child choking is quite simple. It's silent. They won't be able to make a sound. And they may be going pale with a blue tinge. If this happens, they 100% need help from you. I'm using Annie today to demonstrate to you of how you would do the steps in a real life situation. Now, with any child or adult, it's exactly the same steps. Now, if you can imagine, if you were choking yourself, imagine that. What would be going through your mind? You're probably thinking, that's it, my time's up. You're not going to be thinking rational. So when we have a child, we want to ask them, can you cough? The words might not register. So it's a good idea to cough. And that might break into their mind of, oh, I'll see if I can cough. So quite simply, Annie, can you cough for me? Just like mummy, can you cough for me? No. If they can't cough, we must get to the next stage quickly. What we want to do is make sure that we support the child by supporting at the shoulder. Because if you don't support them and you start giving back blows, they're going to fall to the ground. So making sure supporting the child and they are bent over slightly. We're going to use the heel of our hand and we're going to give back blows right between the shoulder blades. The reason why we give the back blows here is because this is where they're choking. And by giving a firm back blow, it causes a vibration in their airway. And that vibration can loosen the object that they're choking on. 80% of the time, these back blows will be effective. Up to 5 back blows. Notice the up to. If it dislodges on the second one, stop. Always make sure they're also looking to see if you can see the object dislodge. That's also important. Nice and firm, 5 back blows. It's okay, Annie, you're going to be okay. 1, 2, 3, 4, 5. If the child is still choking after giving these 5 back blows, we now need to go on to the next stage. It's the same technique as if you were doing abdominal thrusts on an adult. I'm just going to raise up Annie's t-shirt here to show you where you'll be putting your fist on the child. You can see here their ribs. It's like an upside down V. This bit at the bottom of the rib cage, it goes to a soft bit. And look, he's even got a belly button. It's in between these two places that you'd be putting your fist onto the child, as if you're going to punch somebody, but you're not. Turn your fist around to face you and place it right in the center. You want to put your other hand directly on top. Now this is the important bit. What you don't want to do is squeeze. Squeezing them is not going to be effective. We've got a muscle here and we have to get under that muscle to push the air up. So I always describe it like scooping ice cream. Imagine you've got a scoop. You don't scoop like that. You scoop inwards and upwards, inwards and upwards, inwards and upwards. And this then pushes the air up and hopefully dislodging the object. So putting your fist in that space that I've explained to you, your hand goes on. And it's a bit like trying to pick the child up to 5 times. It's okay, Annie, you're going to be okay. 1, notice how I'm picking them up. 2, 3, 4, 5. After you've done those 5 abdominal thrusts, if your child is still choking, it's essential that you get a phone and call emergency services and tell them what's happening. If there's somebody else with you, of course, they can make the call. But if you're by yourself, you have to get your phone and get that call in quickly. But normally it has dislodged by now. If it hasn't, then you're just going to repeat. So again, making sure that you support the child, lean them over just a little bit. Heel of your hand right between the shoulder blades. 5 good back blows, causing that vibration, hopefully loosening the item. Always check to see if the object is dislodged. It's okay, Annie, you're going to be fine. 1, 2, 3, 4, 5. If it still hasn't dislodged, we're going to repeat those abdominal thrusts. So the fist, as we showed you just a couple of moments ago, right into that soft bit. And your other hand's going to go on top. Remember the scooping ice cream, inwards and upwards. 1, 2, 3, 4, 5. And you would just keep repeating that process. But normally it's dislodged by now. If you've had to give any abdominal thrusts on a child, this is soft tissue. It is absolutely essential that you get them checked out, either at the GP or it may be into accident and emergency. Because doing damage to soft tissue, it can cause bleeding, but always remember, bruising, it will heal. Permanently choking, that's when you have the problem. So just a little reminder, try to make sure that your child is sitting down when eating to try and prevent this from happening. Good luck. My name's Sarah Phillips, owner and trainer of Mini First Aid Aberdeen and Aberdeenshire, making training fun, engaging, but most importantly, memorable.